Hi, I'm Rob Reep with SeleneRiverChronicle.com. With the rise of the Omicron variant of COVID-19, Bradley County sustained a significant spike in the number of active cases locally. When case numbers have jumped, we've reported on that rise. And with each article we've published in regards to COVID case numbers, in the past 2 years, we've normally received multiple emails and Facebook messages asking exactly how we get those figures. And the answer to that question is we pull them directly from the Department of Health's COVID-19 reporting site, which is updated daily and is available to the public. You can actually go check it out anytime, and we've put a link at the bottom of this story. However, some readers have asked how the Department of Health itself gets to those daily figures. So today, we are taking those questions directly to Arkansas's state epidemiologist, Dr. Mike Cima, who is with the Arkansas Department of Health, the agency which collects and reports COVID numbers statewide. And we welcome Dr. Cima to SeleneRiverChronicle.com right now. Dr. Cima, first of all, thank you so much for joining us today. We appreciate you coming on Selene River Chronicle to discuss such an important topic that's affecting not only our readers here in South Arkansas, but of course, globally as well. We have, for the past couple of years, since the pandemic began, we've been publishing the daily local numbers as reported by the Arkansas Department of Health on the website. And for our readers who don't know, that's where we get our numbers that we publish, is directly from the Department of Health. But we get questions constantly by email, by our Facebook page, in regards to the validity of those numbers as well as how they're reported. So we wanted to get some clarity, and we certainly appreciate you joining us.
Sure. Thank you for having me.
All right. First of all, in terms of active case numbers, that seems to be where the big hangup is for a lot of people here in our part of the state. In terms of those active case numbers that are published on the Department of Health site, are those confirmed cases in which a test has come back as positive in terms of not just a rapid at-home test, but a test at a hospital or a doctor's office?
Yes. So those are going to include those test results that come back as PCR positive or antigen positive, because those are, widely done in doctor's offices or other settings, pharmacies, school clinics, things like that. So yes, those active case numbers are, reflecting those cases that get reported to us that have a positive PCR or antigen.
What's the steps? Can you take us through what exactly happens from the time a person gets sick to the point that report actually ends up not only on the Department of Health, but then of course filters out to news outlets such as ours?
Sure. So, there is some variety in how cases get reported to us. By and large, at this point, cases are reported to the Department of Health by electronic means. The biggie is called electronic lab reporting. It's essentially an electronic connection between us here at the ADH and clinical laboratories, big commercial laboratories. Essentially, as soon as that test turns positive in that system within that lab, we get a notification that says, hey, this person with details X, Y, and Z tested positive on a PCR on this date. And we get that into our surveillance system, and it's pretty seamless. Now, there's other mechanisms by which we get reports. Another biggie is the fax machine. That still is a very common way of reporting across the state, especially in more rural areas where maybe electronic reporting, especially electronic lab reporting, is just not feasible. So we get lab reports sent to us in a variety of ways, and we incorporate those into our surveillance system. Just as rapidly as we get them. We have people who are entering in those faxes that we get in. The electronic reports that we get, are pretty seamless. Like I said, don't really require too much manual intervention. So once those get received, they get reported out that day. We have a general cutoff time of 10 a.m. every morning. Any cases that we have received between 10 a.m. the previous day and 10 a.m. that morning will get counted in our case reports for the day. And that's the number that is shown, on the graphic that is seen widely on social media, as well as our dashboard.
Right. Our readers will be very familiar with that. We publish those. We're not actually publishing every day as the Department of Health does. We tend to focus on our site when significant hikes take place that would concern our local readers. But obviously, we've been through a pretty significant rise in the last few weeks here in Arkansas, but especially here in Bradley County in the south part of the state. Do we know if that rise has been specifically attributed to the Omicron variant?
So, what I can say is that, we don't, the way we identify these variants is through a process called genomic sequencing, essentially just identifying down through its core elements, what is this virus? Is it Delta? Is it Omicron? Is it Alpha? Or is it wild type SARS-CoV-2? We do not sequence everything. That just is not feasible at this point in time. But what we have is a general understanding of what proportion of the samples that we are sequencing that are random samples throughout the entire state, what those are coming back as. And what that tells us is that Omicron rapidly took over in the latter part of December 2021. And, the CDC puts out numbers, I believe, on a weekly basis that gives an idea of what, variant is in play in different parts of the country. And really, since the end of 2021, Omicron's been the dominant variant, representing greater than 99% of all samples that are being sequenced. So at this point in the game, I feel pretty confident in saying that the rises that we have seen throughout the state since the end of 2021 and now into the first part of 2022 are a result of the Omicron variant.
Although our readers here in our part of the state will know that Bradley County has one of the higher vaccination rates, remarkably, in Arkansas, which I think has been a bit of an outlier, but cases still rose with this latest variant increasing here locally. I believe we were around 430 last week. I think we're down to 378 active cases locally, but I'm beating a bit of a dead horse here. But what can people do to give themselves and their families the best chance to stay safe? What steps? Vaccination, masks?
That's a very good question, and one we get asked often. And there's many things that folks can do to keep themselves and their family members safe. From Omicron, for any variant really that we know of currently, and the best way to do that is through vaccination. Now, we have seen an increase in vaccine breakthrough cases, i.e., those people who have been fully vaccinated or even boosted, who subsequently test positive. However, those individuals who will have tested positive that are fully vaccinated or boosted, their cases are extremely mild. We have seen very good outcomes in that group. So while the Omicron variant has demonstrated the ability to evade some vaccine immunity, that vaccine is still very effective in preventing some serious outcomes, including hospitalization and definitely death. So it is incredibly important at this point to get the vaccination so that we protect ourselves and our family members from serious disease. Now, another important thing that we've been doing now for 2 years is the physical mitigation measures, right? The masking, wearing a well-fitting mask, and especially in public indoor settings where you may not know the vaccination status, or, if somebody is infected at any given moment, it is a really good idea to wear a well-fitting mask in public indoor spaces. Keep your distance, good personal hygiene. Those are all still very applicable during the Omicron surge. But definitely we want to emphasize the point that vaccinations are an incredibly important tool in preventing, the very serious outcomes that we have seen with COVID-19.
So bottom line, get vaccinated.
Get vaccinated, get boosted if you're eligible to get boosted. Yes, absolutely.
Is there any concern that the cases that we found that are published each day, that those are maybe not all the cases that are out there? That's something that we've here throughout Arkansas, but also nationally and internationally. Omicron is a hyper infectious disease. It is arguably one of the most infectious diseases that we know of at this point. With that, in a shorter incubation period, maybe some milder disease, especially in individuals who are vaccinated or boosted, it is reasonable to expect that the numbers that are reported out are conservative in some way, and that's compounded as well by the fact that we've made available 1.5 million at-home tests, and we're not
we've made it clear during press briefings, we are not asking individuals who are sick, who have tested using an at-home test to, burden themselves by reporting that to us. We want those individuals to focus on becoming well. So, with all that taken into account, I think it is reasonable to expect that the cases that we report and have been reporting over the past couple of weeks may be a conservative estimate of what's happening in our communities.
We've talked about the importance of vaccinations. Do we have any idea what percentage of active cases that we're experiencing now in Arkansas are among the unvaccinated?
Yeah, and actually, I believe we update this number regularly. It's provided during press briefings, but I think it's also maybe on our dashboard as well on the vaccine tab. And I believe as it stands right now, about 60% of active cases are among those who are unvaccinated.
Well, Dr. Cima, we don't want to take up much more of your time. We appreciate you so much for joining us here again on SaleneRiverChronicle.com to just give some clarity to our readers as to these numbers. And we also want to just say thank you and all of our healthcare workers for everything you guys have done in the past 2 years.
It is my absolute pleasure. Thank you for the thoughtful questions. It's been a pleasure.
Thank you.
Mm-hmm.